Hi, it's Lydia again, clinical manager with BD, and we're going to go over Purewick, the female external catheter. A few things about this product, a few watch outs. Do not place on a patient that's combative or confused, not a good candidate. And then also, if they have retention, they cannot use this product, okay? So, a few watch outs there. You should have access to a huddle sheet like this. It talks about who is a good candidate for this product. So just going through the criteria here, let's think about those patients that are bedbound. They have decubiti, we're trying to keep them dry. They need accurate I&O. If properly placed, this product will take in over, I can't remember if it's 97 or 99%, but it'll take in quite a bit of urine if properly placed, okay? And if suction's up high enough. Patients post-procedure, patients that are immobilized, maybe they've had a hip fracture, pelvic fracture, femoral fracture, they're a great patient population. They have a hard time getting on off the bedpan, it really hurts. Patients who are bariatric and you have a hard time getting them on and off the bedpan is another great one as well. They can't ambulate, they're a fall risk. Now with that said though, do not use this in lieu of getting them up to use the bathroom because ambulation is healing. So they still need to get up and ambulate as much as possible. But difficulty walking. Something that's not on here though is end-of-life care. That's another patient population I feel is really overlooked with this product. So you can use this product for end-of-life care. This product is connected to continuous suction, not intermittent, but continuous. You start at 40 millimeters mercury or greater. It probably won't be 40, it'll probably be 60 to 80 or higher, quite honestly. The 40 came from an in-home setting where the suction canister is below the bladder, but now it's in an acute care setting, so it's above the head of the bed, and the tubing's longer. So instead of using 6-foot tubing in a home care setting, we're using 10 to 12 foot in a hospital. So we'll need longer tubing, we'll need higher suction volume for that as well. It's placed in between the patient's labia. The anatomy should be enough to hold it into place, and it's tucked into the glutes. We'll hit that in a second. It's changed at least once every 8 to 12 hours, unless visibly soiled with blood or feces, okay? So again, I can only educate you to the directions for use for the product. So this is a nice resource for you. There's also the directions for use poster that you can have as well. So placement, let's talk about placement. The patient's urethral opening needs to touch this white mesh material. The patient voids, saturates this. It collects here in the squishy reservoir, and the only place where there is suction for this device is at the base. There is no suction throughout. It's a straw otherwise, so it's at the base. Before you place it between the patient's legs, you want to do peri-care, do a good skin assessment, make sure that the anatomy looks good, do your charting accordingly, place your product, check your suction first, make sure it's working properly at the end of the Yonkers tubing, make sure it's working properly, then attach it, then place it while the suction's on, in between the patient's labia, like I said. If for some reason securement is needed to hold it into place, mesh panties is something I can educate to, and it's something that's labeled here, down here. If you want to hold it into place, you can use mesh panties. You do need to check it once every 2 hours. If a patient's immobilized, you'll probably be turning them every 2 to 4. So you need to check this product every 2 hours. It is a medical device on tissue. So placement is, you're gonna tuck it into the glutes, tuck the base into the glutes a little bit, curve it up to your urethral opening, and then let normal anatomy fall in on itself. Again, you want the urethral opening to touch here, somewhere between my fingers here. If you can't visualize your urethral opening because it's really posterior to that pubic bone, you could always just make sure that the vaginal opening is around the white mesh material. If they have swelling on their labia, be checking it more often for sure. Do not include this vent at the top. So if you're using this in conjunction with briefs, it could include this vent and could cause suction issues. So be mindful of that as well. So keep this vent open. That's why mesh panties is recommended. Again, it should be changed once a shift unless visibly soiled with blood or feces, and it's great for collecting accurate I's and O's, so you can use it in your ICU. I would highly recommend initiating it in the ER for sure. It can decrease the possibility of using it in indwelling, and then also for duration, it cuts down the duration time for that indwelling as well. Diuresing, if a patient's diuresing, they may need full suction during the time they're diuresing. But once they're done diuresing, you can back it back down. There is no high level for the product, but only use the amount of suction necessary to properly remove urine from patient to the wall, whatever that number looks like, okay? I can't tell you what that is because it's different for each patient. But that is Purewick.